right, good evening, everyone. I want to call to order the Caldwell County Board of Health meeting for this February the 4th of 2021, and welcome those who are in our audience as well as those that are joining us by TV and by Zoom, I guess. So our first item of business this evening would be our invocation. I'm going to ask Dr. Davis if he would lead us in that. And we will follow that with our Pledge of Allegiance, and if the Honorable Wayne Rash would lead us in that this evening. So, Dr. Davis.
Would you bow your heads with me, please? God of all ages, the truth is we are weak and sinful. Help us to see and trust your ways. Give us strength to persevere and faith to endure. In your sight, nations rise and fall. They pass through times of peril. Now, when our land is troubled, be near to judge and to save. May leaders be led by your wisdom. May the leaders search your will and see it clearly. We have turned from your way, reverse our ways, and help us to repent. Give us your light and your truth, and let them guide us. We thank you for all of your blessings and your mercy through Jesus Christ. Amen.
Amen.
We stand for the pledge. For the attention, salute, pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you, everyone. Announcements, Miss Anna Martin.
Just two announcements. Just wanted to mention we made way in our vaccines. Jeannie's going to go over what we've been doing, how many we gave out, and Dr. Picton's going to go over how many or what we have as vaccines. So we're moving towards phase 3 right now. We're still in phase 2. We're doing 65 plus. I also wanted to mention that in the packets you did receive the calendar of meetings for 2021. I just wanted to bring that to your attention.
All right. We do not have enough for a quorum tonight to be able to vote on anything, but we did want to continue with our meeting because there's a lot of pertinent information that we feel like is going to be brought out tonight. And following along in our agenda, for those of you that are tuned in by Zoom, under item 9, the public health update, we're also going to have a provision there, environmental health, some issues that we've got to address there. And let me say that we'll be sending that out as well as some of these other approvals via email. You should see that coming for those that are attending this evening or hear the meeting later by way of the web or internet, but we'll be voting on some of the things that we need approved through our email, and that is currently a process that we use to get everybody's approval. So with that, we'll dispense with the agenda amendments as well as the minutes from our November meeting and move to our financial report. And Jeannie has some information for us there this evening.
Good evening.
Good evening.
Okay, for our current fiscal budget, we've expended 44% of our expenditures and received 59% of our revenue. So our budget's looking really good this year.
All right.
Any questions about that? Okay. And I had 2 budget amendments that you should have in your packet. One is for a grant in the amount of $41,400 that was received from the Women and Children's Immunization Branch, and that's to be used for vaccine planning and implementation. Currently, we have it targeted for medical supplies and different supplies for vaccine clinics, but we may need to look at using that for some salary issues later on.
All right.
Y'all want to vote on them individually or first.
Well, we
Well, we
won't be
can't.
able to
Okay,
vote on
sorry.
them, but you can sure tell us about them so they'll know that it's coming.
And then our next budget revision is for our dental clinic, and it's actually just to move, the funds were already in the budget in the amount of $6,016. It was initially budgeted in medical supplies, but we're requesting to move that to equipment to purchase a new autoclave. Our last autoclave was purchased in 2006.
All right. So the emails will be coming to our board members for these budget revision requests in the amount of $41,400, and then for the vaccination program, and then steam sterilized for our dental clinic of $6,016. So you folks can expect to see that tomorrow. All right. Thank you, Jeannie. That moves then to our public health update, and we've got an item, again, that's falling under our environmental health. Did Mr. Weir join us as well? I thought he was going to be here this evening, too.
Yes, I'm here.
Okay. So, Mr. Weir, thank you for being a part of our meeting this evening. I don't know if you've heard, but we don't have a quorum, but we're wanting to go ahead and address this to get it as a matter of record, what we're kind of doing, as well as some of the reports that's coming through. So, but in that, many of our folks may remember, I think we found this on the minutes meeting of March
2018.
2018. We had addressed an issue at that time with our environmental health supervisor, who was requesting a policy change and procedure change that would allow us to deem it necessary to have a pit dug when trying to apply for a septic tank. So I remember that discussion because I was on the board, and many of us will, but do you have anything you'd like to add to start with, kind of as a...
Sure. So, just kind of going through the minutes, just to give you an update of what this proposal was. This proposal, or proposed protocol was pits will be required for initial soil site evaluations for new septic permits and for expansions of existing septic systems in areas of Caldwell County, so not the entire county, that are likely to have shallow mountain soils as evidenced by the general soil map that was provided at that time. So currently, well, before this, environmental health specialists would have to auger the areas instead of having the pits already done at that time. And it was only areas that this proposal was for to have the pits done ahead of time to save time for the specialists to be out there. So the proposed protocol is to extend the certain areas to the entire county. And I don't know if Johnny wants to kind of go more in depth, but this is kind of what was proposed that night, was to have certain areas, pits dug before the specialists went out there.
And so now we've had some growing pains, if you will, with our environmental health division. We've had some change in personnel there, and we've got some new personnel coming in, but it seems to be that this standard is being adopted more and more in our state, and certainly we want to adhere to what most folks are doing in Caldwell County. And what it means is when you apply then for a septic permit, before our environmental health specialist would come on site, the contractor, the landowner, whoever would have to have a backhoe on site and available to dig the pit so we could see the subgrade and soil levels and the variances that would be required for installing a septic system. So, and Mr. Weir is with the COG, and they've got a lot of experience in this as well. I don't know, John, if you want to add anything to that or not, because we're again trying to give out the information for our folks to be able to to see and understand than those that'll look at this meeting afterwards. So,
Correct. So, yeah, I can add something to that. So a lot of these sites, they may be all the way across the county. So staff will go out there and knowing that they're probably going to have to require pits anyway. They'll go out there, check the site, and then tell them they have to do the pits, and then have to make a follow-up visit, say somewhere around 2 weeks later. So for efficiency's sake, that's, doesn't work as well as it would if you went ahead and required the permits, and that way staff can make one trip out there and go ahead and view the soils that they need to see. So, and yeah, there are some counties that are adopting it across the state. Iredell County, for one, just changed theirs in 2017 or 18, and Catawba County currently requires them. But also, Caldwell County has very variable soils in a lot of the county, and the soil depth changes very rapidly from one place to another. So you may auger a hole in one spot and then not realize that there's rock or something there really close by that may cause issues for the septic tank going in. So if it's not called, this causes issues for the property owner down the road and for Caldwell County. So, requiring the pits can sometimes help a tremendous amount in trying to determine whether the spot is good for that kind of thing.
yes, sir. And to go along with that too, really it's just probably more of an employee safety factor now in the fact that our employee wouldn't have to worry about getting an auger device off of the vehicle and go out there and hold that thing, and sometimes it takes two people to hold the auger to dig a hole, and so we're just trying to eliminate some of those issues that we have with our employees, and we currently have a couple positions open in our environmental health division right now, and we have found in trying to recruit folks that is a point of satisfaction for even considering coming to a county is if you're digging pits as opposed to carrying some auger 30, 40, 50 yards, 100 yards sometime into the woods to try to dig a hole to figure out if somebody can put a septic system there. So with all of that,
one more
go ahead.
point I was going to make is that up to 80% of properties are currently requiring pits. So that's a tremendous percentage already. I'm sorry, I didn't mean to interrupt you.
No, it's okay, John. And with 80% already requiring it, it's not a big stretch for us to just go ahead and say across the board in Caldwell County, you'll have to have a pit dug. And I might add while I'm there, and I don't know how the language needs to be for that, but also having the property lines clearly marked. I remember some of our former staff making light of that as well when they show up on site and people doesn't have their property lines marked. Your septic system has to be so far off of the property lines, and so that's a determination that needs to be made as well. So those property lines need to be clearly marked and available for our inspection, if you will, so we know where to place the system once we get there. So that may be a provision as well in tying all this up to make it a little more user-friendly for our staff, if you will. So does anybody have any questions or comments from? We've tried to be pretty explanatory in it, and again, folks can go back and watch this and glean the information if they'd like to. So Anna will be sending that out, or Libby one, and it will be a motion that we then adopt pits being on site and available to have the pits dug prior to our staff arriving, and it's going to be a countywide policy. And so environmental health, again, will help them, assist them in getting their job done in a most efficient manner instead of going back a couple, 3 times. All right, Mr. Weir, you got anything else?
That's all I have. Thank you for your time.
Well, we appreciate you joining us this evening and giving us your perspective as well as what's going on around the state. So thank you, sir.
Thank you.
All right, so next on our list is flu and COVID update, Dr. Picton. And I assume Dr. Picton is at the HHS building, if we get him brought up somewhere.
Slideshow for beginning. Slideshow. Slideshow. Yeah, great. Good evening.
Good evening.
So tonight I thought I'd just do a very brief update on the flu situation for 2021, and then as far as COVID, because maybe there's some confusion or misinformation on the COVID vaccines, I was going to try to briefly go over the different types of vaccines, what their purpose and what their use is. We'll see how that goes. So this slide kind of sums up the 2020-2021 flu season. This compares the 2018-2019, 2019-2020, and the 2020-2021 flu season. And as you can see in the red line, it has just hovered around 1%. Up to this point, there have been 4 deaths in North Carolina so far this season. By this time last year, there were 71 deaths. Of what influenza is circulating, it seems to be influenza type A that seems to be the predominant strain. So apparently the COVID protocols for reducing transmission work even better for influenza. Compare this to the North Carolina COVID deaths of 9,397. That was last week when I was preparing this presentation. I know it's even higher than that now. So we have not done as good a job against COVID as we seems to have done against the influenza. And if you're one of those that thinks that COVID is no worse than the flu, unfortunately, you're mistaken. So now to the coronavirus. Just a brief review of how we got here in case you forgot. COVID-19 was first identified in the Wuhan province of China back in December of 2019. And the first reported case in the United States occurred in Washington in a man who traveled from Wuhan, China, and was diagnosed and fell ill on January the 19th. The first death in the United States was on February the 29th. This was the first confirmed death in Washington State. But when they went back and did post-mortem testing on some suspicious upper respiratory deaths that occurred before that, they did confirm that COVID-19 deaths occurred probably at least as early as February the 6th and 17th in the San Francisco Bay Area. So probably the virus was circulating even sooner than we thought. And 3 months later, we reached the milestone of 1 million cases. And 9 months after that, we have reached the milestone of 24.5 million with over 400,000 deaths. So that's how we got here. So how do we get out? I think the consensus is that vaccination is going to be the only way out of this. There are 2 currently available vaccines that have been approved by the FDA for emergency use authorization, and that is the Pfizer COVID vaccine and the Moderna COVID vaccine. There's 3 other vaccines in phase 3 clinical trials, and that's the AstraZeneca COVID-19 vaccine, the Janssen COVID vaccine, which is more commonly called the Johnson & Johnson. The Janssen is the vaccination branch of Johnson & Johnson, and the Novovax. So to discuss briefly how vaccinations were made in the past, the main concept in producing a vaccination is to find the part of the vaccine that our immune system recognizes and then mounts an immune response to, and that protein on the virus is called an antigen. And the whole concept is to get these antigens into a vaccine, inject the antigens into our body so our immune system can recognize these and then mount an immune response. So the old ways to do these were we would either grow viruses in chicken eggs or human cell line eggs or human cell line cells. And we would grow the virus, and then the first way was to actually grow a couple million viruses or billion viruses and then tear the virus apart, isolate the antigen or the immune responding part of that virus, and then purify it, then put it in a vaccination and inject it. The other way was to take those viruses, instead of tearing them apart and taking out just a specific antigen part, was just to weaken the virus itself, keep the antigens on it, and then inject the virus into our bodies. And that way it doesn't replicate as well, but it can still mount an immune response. Unfortunately, these took multiple steps, and they took it took a longer time to process. The newer method is called recombinant technology, and that's where they take the part of the DNA from that virus that actually codes for that antigen, incorporate that into a bacteria DNA, and then when the bacteria starts copying off its DNA, it just starts inadvertently making this viral antigen, and then they can isolate, purify, and put that antigen in a vaccine and inject it. Those were the previous methods for vaccination development. Pfizer became the first vaccine to receive emergency use authorization by the FDA, and this is a messenger RNA vaccine. And we'll go over what a messenger RNA vaccine is in just a minute. This requires 2 injections, 21 days apart. It has been studied for people over 16 years of age or older. It's not been really studied in pregnant women or lactating women. There's no theoretical reason why these should be dangerous to pregnant women or lactating women, but because they haven't been studied, the current recommendation is to discuss it with your OB provider to decide if your risk for COVID warrants to take the testing of the vaccination. But most vaccinations are very safe in pregnancy, and some vaccinations we purposely give in pregnancy to give the baby the immune antibodies that they'll need when they come out, because they can't make their own antibodies for 3 months. So who should not get the vaccine? Again, just those that have any allergic reaction to any of the parts of the vaccine itself, which there's not much there but messenger RNA and a phospholipid capsule. The side effects are fever, chills, tiredness, and headaches like any other vaccination, and these do seem to be worse after the second vaccine. The vaccine turned out to be 95% effective in preventing laboratory-confirmed COVID-19 illness in people. They were hoping for between 50 to 70% effective, and these turned out to be 95% effective. 6 participants did die during the 44,000-person Pfizer vaccine trial, 2 of whom were in the vaccine study arm, and the other 4 were in the placebo study arm. And all 6 deaths, including those in placebo, represent events that occurred in the general population for age-appropriate rates. 21 cases of anaphylaxis, which comes out to about 10 per million, or 1 per 100,000, which is a little higher than the normal vaccine, about 1 to 2 per million. The Moderna vaccine is also a messenger RNA vaccine, 2 injections, 28 days apart, and this was studied in people 18 years of older. Again, there were no studies in pregnant or lactating women, but there don't seem to be significant risk for these women. Who should get the vaccine? Who should not get the vaccine? Again, anyone that has an allergic reaction to any of the parts of the vaccine, which are very few. The side effects, like the Pfizer, fever, chills, tiredness, and headaches, more common after the second shot. This one was also 95% effective. Deaths, again, were uncommon, with 6 in the vaccine group and 7 in the placebo group. And I couldn't find any of the information for anaphylaxis, but I think it's similar to the Moderna, to the Pfizer vaccine. So what is messenger RNA? Messenger RNA is actually how our body cells produce the proteins we need. I mean, how does your pancreas cells know how to produce insulin? How does your thyroid gland know how to make thyroid hormone? How does your GI system know how to make your digestive hormones? All of these proteins are actually coded for in our DNA. And actually, that cell is able to find its part of the DNA that codes for those specific proteins, and it can copy off that part, and it can make, and that's how we make messenger RNA in our proteins. So basically, messenger RNA is coded for by the DNA in our cells, and the nucleus is able to recognize that part of the DNA to make these proteins, and then it makes a copy of it, which is called transcription, and then that becomes RNA. When you make a copy of your DNA, they now call that RNA. And then that RNA goes out into the cell itself where it actually makes the protein. And that's what's called messenger RNA. And this is called translation. The specific part of the cell where the translation occurs is in the ribosomes. And then after it codes for that protein and the cell makes that protein, the messenger RNA is rapidly broken down and goes away. This is just a schematic of, you can see the double-stranded DNA. Basically, all of our cells have 23 chromosomes, which are 2 pairs of each, and the chromosome separates. The nucleus recognizes that part of the DNA, and it makes the copy there, and then that becomes RNA. And then the RNA leaves the nucleus and goes to a part of the cell called the ribosome. And you see those little, they got T, it's called translation RNA. Those 3 little prongs are called codons, and those carry amino acids. And those amino acids match the codons on the messenger RNA. It lines up the amino acids and builds the protein. And that's what messenger RNA does. Is everybody with me, kind of? So, what do messenger RNA vaccines do? Scientists were able to isolate the spike protein because it's the spike protein that our immune system recognizes as, and it amounts an immune response to that spike protein. So scientists were able to identify the spike protein, figure out the amino acid sequence in it, and then in the lab you can synthesize a copy of that messenger RNA that codes for that amino acid sequence for that spike protein. So you synthetically make that messenger RNA and you stick it in a lipid coating. That's the little lipid coating that protects the messenger RNA, and you put it in a bottle, and then you take it to someone and you pull it out and you inject it in somebody's arm. When it goes in that arm, probably that lipid coating sticks to the cells, which is probably your muscle cell in your arm, and that lipid coating sticks to the muscle cell, and then it injects the messenger RNA into the cell. And because it's already in the messenger RNA state, it actually goes to the ribosome, and the ribosome starts putting the amino acids together to build the spike protein. And then those spike proteins go out to the outside of your cell wall, and then your immune system can recognize the spike protein, and it starts making an antibody response. And after a few hours, that messenger RNA is degraded and goes away. So what the problems with messenger RNA is, the main problem is it's very fragile. It's under constant threat of being degraded. And for that reason, the Moderna vaccine can only be stored, has to be stored at -4 degrees Fahrenheit, and the Pfizer at -94 degrees Fahrenheit to keep it stable, to keep it from being degraded. To prevent any damage, vaccine producers not only made chemical changes to the messenger RNA, they also wrapped it in a protective layer and then put it in very low temperatures. The other problem with messenger RNA is it seems to require 2 doses to amount a 95% immune response. Any specific questions on messenger RNA vaccines? So to make it even more confusing, the other 3 use something called DNA. The Oxford AstraZeneca vaccine decided to use the whole double-stranded DNA instead of making the copy into messenger RNA. So they spliced a piece of that DNA that codes for the spike protein gene and put it in a virus called an adenovirus. That virus cannot replicate inside the body, but it acts as a carrier to get that piece of DNA into our cells, so our cells can make the spike protein. So after this virus with the DNA from the SARS or the COVID vaccine spike protein in it goes into the person's arm, the adenovirus again bumps into cells, most likely your shoulder muscle cell, and it latches onto the cell. The cell then the virus then engulfs, is just engulfs into the cell itself, And then the virus wanders to your nucleus and injects the DNA into the nucleus. And then when the DNA is in the nucleus, even though the whole virus DNA cannot be copied off, that spike protein is then copied off into messenger RNA. And now we're back to where the messenger RNA is like the other messenger RNA vaccines. And this is just a schematic of the adenovirus with the spike COVID vaccine DNA in it. Touches a muscle cell in your arm, and then it gets engulfed into the cell. It wanders to the nucleus, and then it injects the DNA into your nucleus, and then your nucleus copies off that DNA and makes messenger RNA. And just like messenger RNA in the Pfizer and the Moderna, the messenger RNA goes to your ribosomes, where it starts putting together the amino acid sequence to form the spike proteins. The spike proteins then wander out to the surface of your muscle cell, and then your immune system recognizes the spike protein and starts mounting an immune response. The advantage of the adenovirus engulfed DNA is that the adenovirus probably provokes somewhat of an immune response itself by turning on the immune system, which probably allows a little bit stronger vaccine and only allow a stronger reaction and just allows one vaccination to be effective. And this is schematic where the messenger RNA has left the nucleus, is now in the ribosome, and it's making copies of the spike protein. The spike protein wanders out to the surface of the cell, and then our immune system recognizes it and starts making antibodies. So the AstraZeneca, which is not yet FDA approved in the US, requires 2 injections 28 days apart, although some data is looking at 1 injection. And surprisingly, the vaccine combination in which the first dose was only half strength and the second dose full strength was 90% effective. I think they made a mistake and sent out half dosings to some people. And when they did the study, the half dose in the first shot with the full dose in the second shot was 90% effective, and 2 full dose shots was only 62% effective. Stay tuned for the final study results and possible FDA approval. The benefit of DNA is it's much more stable than messenger RNA. These vaccines can be stored and transported and handled at normal refrigerated temperatures for up to 6 months. So the Johansen COVID vaccine, otherwise known as the Johnson & Johnson vaccine, is also an adenovector vaccine, which means they put the DNA inside an adenovirus and then inject that into your arm. And 45,000 people were enrolled in phase 3 trials. One of the biggest perks of the Johnson & Johnson vaccine is its durability, because it doesn't harbor delicate messenger RNA like Pfizer and Moderna. It's much less fragile. It can stay stable in normal refrigerator for up to 3 months. The second perk is single dosing. Johnson & Johnson said Friday that data from its late-stage trials in the U.S. and 7 other countries showed the vaccine had an overall 66% effectiveness in preventing moderate to severe disease. And actually, in most vaccines, 66% effective is terrific. However, when you compare it to the 95% of the Moderna and the Pfizer, it maybe is a little bit less effective. But the main thing is it's 85% effective against severe disease and death. And after 28 days, there were 0 people that had hospitalizations or deaths after the Johnson & Johnson vaccine. So it's very good in preventing severe disease and death and hospitalization. In one shot, that can be stored at refrigerator temperatures for a long time. The last one is the Novovax, and this actually uses traditional technology of the recombinant DNA. That's where they took a piece of the DNA from the coronavirus or the SARS or the COVID virus that codes for the spike proteins. They put it in a bacteria in the lab, and the bacteria in the lab starts copying off its DNA and starts making the spike protein. And then the spike protein is isolated in the lab, purified, and put in a vaccination. That's the old technology. So what's the bottom line? All these vaccines appear effective. All these vaccines appear safe. So which is the best vaccine? The best vaccine to get is the one available when your group is in line for the vaccination. And that's it. More confusing now?
Well, you've had a lot of good explanation there and interesting facts that I certainly appreciate hearing from Dr. Picton. Anybody else have any question or comment for Dr. Picton? All right, hearing none, then we'll move on to our 2020 annual report. And again, Miss Jeannie Walker, as well as our COVID vaccine. That's probably more important information, how people can get their vaccinations.
Mine probably won't be as interesting as Dr. Picton's. I just kind of wanted to go over what we've been doing with our COVID vaccine. Currently, we've received 4,070 doses of COVID vaccine. That's 2,045 of the Pfizer and 2,025 of Moderna. We've administered 3,349 doses of those vaccines to date. We are currently taking appointments for those who wish to come in and get a vaccine. We do have a waiting list. If you have not seen we have a lot of information on social media and billboards on the ways to register for the vaccine. So you can go to vaccine.caldwellcountync.org if you'd like to be placed on our waiting list. And then we'll give you a call once your name comes up. We are doing primarily groups 1 and 2 currently, and that's healthcare workers, and then those that are 65 and older take top priority currently. One of our biggest issues has been vaccine supply. You know, we've requested a certain amount from the state. We would like to receive about 2,000 doses a week in order to adequately vaccinate those on the waiting list. We currently receive about 400 doses a week. And so those, as you can see, go pretty quickly. We do have vaccine pods set up at the health department. We currently have 4 pods, and that's how we distribute the vaccine based on their appointment. Those have been going really well. We've gotten lots of compliments from people who've came in to get their vaccine about, you know, they think they're going to have to come in and wait for 2 or 3 hours, and they actually have an appointment. They come right in, get their vaccine. The longest time they wait is the 15 minutes that's required after they receive their dose, just so that we can monitor them for side effects. So, and our staff has done a tremendous job with that. I'd like to say kudos to all of them for all the hard work that's went on, because there's a lot of behind-the-scene things as far as registering them into the system, you know, giving the vaccine and documenting that, and then we have to make them a follow-up appointment. While they're there, they get an appointment to come back for their second dose. So,
How many doses could you give out a day, Jeannie, if you...
With the way we've set it up, we could easily administer about 400 doses a day.
So we're getting 400 a week, and we could put out 400 a day?
Yeah.
Okay.
We've done a lot of second dose.
That's how many every 15 minutes? It was like, what, 12?
12 every 15 minutes, 12
Yeah.
people every 15 minutes. And that's the way we've set up the pods to where we can still practice social distancing and keep everybody
Right.
safe and still continue to, you know, to protect people from COVID.
Yes, ma'am.
Yeah. And I do want to thank Jeannie. Jeannie's organized the pods and organized with the vaccines, and she's done a fantastic job, and the staff working together with this. You know, at this point, we went through contact tracing and testing, and now we're at the vaccine. So it's something different, something new, but we're still, I know everybody's tired, but we're still working together, and they're doing a fantastic job. We're also getting nursing students and med tech students from the college, and they're doing a fantastic job too.
Yeah, they've been a tremendous help. We average about 5 to 7 students a day that help us with the vaccine pods.
Yeah.
So they've done a great job. And they're really appreciative because they've not been able to get a lot of clinical experience because of COVID.
Right.
So it's helped them with their clinical experience as well. So.
That's good. All right. So anybody else via Zoom have a question or comment, or? All right. Well, hearing none, then I guess we'll move to the annual report.
Okay, this is for our 2020 annual report. And of course, it's got a lot of COVID information in it because that's primarily what we've done for 2020. The health department has just tested 4,251 people for COVID testing. We've had 5,000, let's see, oh, this is for 2020, 5,860 cases in the county with COVID. We've had, at the end of December, we had 77 COVID deaths. Unfortunately, that's a lot higher now. And then we began mass vaccination in late December with our COVID vaccine. And then for some of our department highlights, for our child health department, our Caldwell County school nurses have served 11,225 students in 25 schools in the county. For our case management program in child health, which is now called CMARC, which is case management for at-risk children, and those are aged birth to 5, they received 283 new referrals, and they currently have 127 clients that they're serving. We had, in the school system, we had 386 positive student cases with COVID and 133 positive staff members. And our immunization rate for the Caldwell County Health Department remains 100%, which is awesome because I know that's kind of been one of the another areas that's been really hit. It's been hard for kids to get in for well checks and immunizations because of the barriers that COVID presents. In our dental department, we've had 1,400 patients, and that's adult and children, that were seen in 2020. And then we had, and during the dental clinic, they did over 900 sealants and seen over 200 new patients. And then our animal control, we had 62 animals that were reunited with their owners. We had 101 animals that were adopted and 118 animals that were rescued. And for vital records, we had, in 2020, we had 269 births and unfortunately 985 deaths.
All right.
Any
Anybody
questions?
have any questions there?
And we have continued to run, a lot of our programs despite COVID throughout the year. We are currently kind of downsizing our clinic area, so we're only seeing like things that are required for our clinic area so that we can concentrate on COVID vaccines.
And that was a recommendation from the state to do
Yes.
kind of minimum, but we have to focus on vaccines and get those out.
Yeah.
Any questions?
All right.
Okay, thank you.
Thank you. Community Health Grant, Kristy Money. Are you with us, Miss Money?
I'm here. I don't have a cool background like Dr. Davis. I'm very jealous. So I just wanted to update you a little bit on the community health grant. I know we've talked about this many times before, but we're on our last year for the grant, so it runs out in June. Just some highlights of what we've done with the grant. We have hired a full-time dental assistant temporary and a part-time interpreter temporary. We've also, of course, since the beginning of the grant, we've roomed 2 operatories. We've fully stocked those, so we have 4 total rooms now, whereas we had 2 before we started with the grant. We've gone from seeing no adults to 400 adults, over 400 adults in the last 3 years, which is awesome. We see the adults, of course, through our maternity clinic. We try to go ahead and schedule the maternity patients in their first trimester, and then we've seen them through Helping Hands Clinic referrals, and of course the sliding fee through patients that are in our clinic. The grant was for $150,000 each year, so we've gotten that for 3 years. And we would like to get approval to reapply for the grant. Like I said, it runs out in June, so the next year will start July 1 if we receive the grant again. We're going to continue to see the adults through Helping Hands and the other avenues. And we're going to continue our incentive program with maternity patients where they get an ultrasound gift certificate, a 3D ultrasound, if they meet certain criteria, keeping appointments, their first dental appointment, all that, to be able to earn this 3D ultrasound, which the patients really like. We've had a lot of feedback on that, and the patients love getting that gift certificate. We would like to, with the next cycle grant, to maybe offer some other incentives for patients for just keeping appointments in the maternity clinic. If they have a WIC visit, there's just different little things that we've come up with for them to earn points, to be able to earn prizes, diapers, wipes, diaper bags, that sort of thing, stuff that they can use for the baby. Just to see, hopefully, our show rate to increase with those patients. We have a lot of problems with the patients keeping their postpartum appointment too. So that's also part of the incentive program if they show proof that they've went to their postpartum appointment. And we want to increase education on substance abuse with maternity patients, and also like vaping and tobacco use with pregnancy, and also, of course, with the dental patients. So we would like permission to be able to apply for this grant again.
Yep, I think, again, I don't know we have to vote on that motion, but those of us here certainly would give that permission. I think Dr. Davis may lead that charge. Is that right, Dr. Davis?
I'll be glad to help in any way that I can.
We appreciate that.
Dental is very near and dear his heart, I know.
Especially the vaping part and the tobacco cessation part.
Yes, sir.
Yes.
So, yes, Kristy Money, you go forth and prosper, as they say.
Thank you. I appreciate that.
We do too. And I know our residents of the county appreciate it, and being able to get to a dentist is very important. And so I'm glad we're able to provide that on some level, and we appreciate all you folks do.
Thank you.
All right. Next on our agenda was the establishment of an ad hoc budget committee. It's that time of year at the county in which we'll be developing our budget. So myself and Wayne Rash, as well as Dr. Davis, have all volunteered to serve on that committee this evening, and we will be trying to have some meetings going forward sometime in that March, April timeframe. So we'll work toward that. And looking at our calendar, then our next Board of Health meeting would be on May the 6th. And again, it'll be a Zoom and chamber meeting for those able to attend. And we'll try to make sure everybody has their contact information and ability to Zoom in. So does anybody else have anything for the good of the group this evening? All right. Well, thank you again for everyone who attended, and call some of our fellow board members and let them know that we miss them and that our emails are coming out for approvals sometime in the next few days. So with that, I will adjourn this meeting and say have a good evening and be safe. And remember the 3 W's. All right. Thank you for everyone for being here.